Hi, I'm Dr. Saami Khalifian. I'm a double board certified dermatologist in Encinitas, California. And I've been using Lipoderma for quite a while now. And a lot of my patients, both on face and off face, we've been getting incredible results. And one of the things I like about Lipoderma is it's giving patients what they're looking for. That is a natural result with a product that's natural, something that conforms to the tissue that they've lost, and it's giving back form and function to the thing that we're seeing patients lose both in the GLP-1 era, but also just as a natural part of the aging process. So being able to restore the fat that patients are losing, whether just as a process of aging or from medication or other issues, this is a product that patients really resonate with, and they resonate with it because it's natural. It's their tissue that we're giving back to them. Although we're using cadaveric fat, this fat is ultimately replaced by their own fat. And so I think this is something that when we explain to patients the benefits of this type of product and the natural aesthetic that it creates, the soft contours, the way that it moves in animation, the way that it looks in repose, all of these things are things that when we show patients the results that we're getting, they really rally behind it. Lipoderma really has changed the way we've approached patients. I think it's allowed us to do a couple of things that I didn't like to do with other types of products. So for example, using a hyaluronic acid-based product superficially in the anterior cheek or even in the under eye, I've always been very cautious with that, and I don't prefer that approach. Instead, using Lipoderma in these tissue planes, it allows for a really natural result, and I think that's where when we show patients the kinds of results that we're getting, they really like what they're seeing. And so, as I said previously, restoring like with like, restoring form and function, this is ultimately the holy grail, and I think with this product, we're able to do that. Whether it's on face, off face, neck, hands, all of these places, the thing that people lose, often it's fat. Certainly there's loss in other tissue planes, but the greatest amount of tissue loss, it's fat. So giving them fat back, I think that's ultimately, patients just get it. And from a practical perspective, from a scientific perspective, this is actually what we want to be doing anyways. And so instead of leveraging products that are collagen remodeling, well, collagen often isn't the primary thing that they're seeing in terms of volume loss. When we consider, for example, the skin, the thickness of skin is not that thick. So we're talking at most on face 1,000, 2,000 microns, 3,000 microns at most, and that's pushing it. So if we're really losing more fat, then replacing fat just makes sense. One of the things that I care about the most is skin, and I will admit that I believe that skin is the primary indicator of age. That being said, we will lose volume too, and having something that both volumizes you and improves your skin quality, that to me is just a double whammy. And I think what we've seen and others have seen, and Brightside is also seeing, is the impact of this injection of fat on skin. So scientifically, we know that adipocytes signal to the skin, and that signaling is actually causing skin changes that I don't even need to tell patients. Patients are coming in and reporting back to me, hey, we did this injection and my skin looks amazing. We didn't laser them, we didn't do anything else to them. It's purely the impact of the adipocytes signaling to the skin, causing changes at the cellular level to the skin quality and giving more radiance, more glow, a smoothness to the skin. And we're accomplishing that in spades. So I think this product, it's achieving our goals on a multitude of fronts. When we leverage it in the way that we do through synergies of other treatments, it just plays extremely well with everything that we're doing here at Saami Aesthetics, and I think our patients are loving it.